because of Delhi's location and also by virtue of Delhi being the national capital, it sees an influx of people from around the country. Not just that, because of its particular character of being at the center of the national capital region, it sees people from the neighboring areas also. So the kind of influx that we see in Delhi and Delhi's hospitals for the time being right now, from areas like Ghaziabad, Faridabad, Gurgaon and Noida and other parts of the national capital region, that is something that is not seen in any other part of the country. That is a factor working against Delhi. What also is working against Delhi right now is the weather, the air pollution, both of these factors contributing heavily to the spike in cases. Now, air pollution in fact is ensuring that the recovery is delayed, which means that more and more people are right now spending time in hospital, which means that hospital beds are occupied for a longer duration. Now, Centre is helping in building capacity in terms of hospital beds and also is flying in healthcare workers from other parts of the country to Delhi. That again is the plan. Now, one of the reasons being is that there is extreme COVID fatigue among the healthcare workers in Delhi that is being seen, and it is at this time that the Centre is planning to get in healthcare workers from other parts of the country, and this is a much needed move given the fact that at this point in time help is required. There is a lot of antigen testing which is being done in Delhi. So symptomatic people who actually test negative on antigen are in fact going back home, which obviously means that if they are COVID positive, they are going undiagnosed. So if you're symptomatic and if you're negative on antigen, by virtue of being symptomatic, if you have to undergo RT-PCR testing, that is going to ensure that more and more people get tested positive for COVID-19, and the chain of transmission essentially then gets broken. Given the fact in Delhi there have been quite a few instances of people choosing to be at home and their condition worsening. That should not happen is the suggestion from the Centre, and for that reason monitor the health care of patients who are recuperating at home. Often even the basic phone calls from the healthcare centres are not being made to these patients, and this needs to be looked at very closely is what the suggestion of the Centre is.